Good afternoon, everyone. Thank you for joining us for this last session of the day. My name is Bronwyn Starr, and I oversee the New York State Health Foundation's Healthy Food, Healthy Lives priority area. I want to welcome our panelists today from the advocacy group Hunger Solutions New York, Sherry Tomasky, the Director of Communications and Public Affairs, excuse me, and my colleague from New York State Health Foundation, Sophie Wheelock, our Policy and Research Associate. So we all know that food insecurity is a secondary crisis of the pandemic. Millions of New Yorkers have lost employment or are living on a reduced income, straining their ability to have food. At the same time, social distancing measures have disrupted previous pathways to food access. The New York State Health Foundation has issued 3 reports to date since the start of the pandemic examining food scarcity rates in New York State using weekly self-reported data from the Census Pulse Survey, which is an experimental data product designed by the U.S. Census Bureau. The survey is providing near real-time data on household experiences during the pandemic. And so today, the panelists are going to discuss the report's most recent findings. We'll talk a little bit about how trends compare with food scarcity pre-pandemic and also provide recommendations on how state and federal programs can improve food security and prioritize funding and outreach to food insecure populations. And then, of course, we'll have time for discussion and questions and answers from you at the end. And finally, before we get started, all of our reports are on our website. You can access them there. It's New York State Health Foundation, nyshealthfoundation.org. And with that, I'm going to turn it over to my colleague, Sophie, who will first present the data and methodology of the survey.
Thanks so much for that introduction, Bronwyn. I'm extremely excited to have the opportunity to share with you the findings from our analyses looking at food scarcity across New York State during the pandemic. And as Bronwyn mentioned, the data that I'll be sharing with you today comes from our most recent report, which was just released yesterday. Now, before I actually dive into some of the findings themselves, I want to take a step back and talk a little bit more generally about the different ways that we can measure different forms of food hardship. Now, there's a lot of different vocabulary that many of us are already familiar with, like food insecurity, food insufficiency, food scarcity. And it can be hard to try to come up with a pre-pandemic comparison when we look at an analysis during the pandemic, because sometimes we cross across different data sources that use different definitions. So at the start of the pandemic, when we decided that we wanted to be looking at changes in food scarcity, normally what we would use as a data source would be the Current Population Survey's Food Scarcity Supplement. And this is really the gold standard for collecting information on food hardship. It's administered by the U.S. Census Bureau and the Bureau of Labor Statistics, and it's a very large nationally representative survey that asks people about their experiences accessing food. Now, it measures something called food insecurity, which asks people both about the quantity of food that they have, but also the quality of food, whether they have enough food. And it asks people about their experiences over the past 12 months. Now, because this is such a large data source, and because it is so robust, it takes time to process and release this data. It takes about 9 months. So that means that we had to look for something else at the start of the pandemic to try to have some kind of a nearly real-time analysis of what was really happening on the ground. That being said, it can be a good reference point. So we know that from 2016 to 2018, about 10.5% of households experienced food insecurity in the last year in New York State. So we are fortunate that the Census Bureau designed a new survey shortly after the start of the pandemic to be able to measure in nearly real time people's experiences. And this isn't just limited to food hardship. This new survey, called the Household Pulse Survey, asked households about all kinds of experiences over the course of the pandemic, and it's still ongoing. Some of these questions include mental health experiences, whether people have started teleworking, their spending patterns. And what's great is with such a nimble surveys, the Census Bureau has been able to add more questions over time, like people's attitudes towards the COVID-19 vaccine. And we're fortunate that there is a question that looks at food hardship. Now, the Pulse survey asks about something called food insufficiency, also referred to as food scarcity. And this is just asking people about the quantity of food that they have, whether they have enough food. This is in distinction to the food scarcity supplement, which is both quantity and quality. So when we look at the data ahead, I want you to keep in mind that this is asking about a more severe form of food hardship, whether people's food amount is actually being restricted. It also only asks people about their experiences over the last week as opposed to the last year. So this is a shorter window for people to have experienced any kind of food hardship. So I really want to drive those two distinctions home, the fact that data is only collected over the last week and that it measures a more severe form of food hardship. So really, the data that we'll be looking at in the coming slides is probably an underrepresentation of the full scope of the crisis of food hardship in New York State. If we were using a data source like the food scarcity supplement, the rates would likely be much higher. So with that context in mind, I'll go ahead and bring up some of our data from the analysis. So I want us to first look on the left here to the figure on food scarcity. And this is looking at the percentage of adults in households where there was either sometimes or often not enough to eat in the last 7 days. And our analysis started in May 2020, and we saw that over the course of 2020, food scarcity steadily crept up, reaching a rate of about 14% in December. And again, this is a very severe form of food hardship, the fact that people's quantity is being restricted. And if we were asking about a longer time period, or if we were asking if people didn't have enough of the kinds of food that they wanted, we would likely see a rate much higher than that. What's interesting is starting in December and going through March, we saw our first period of decrease of food scarcity, reaching 12% in March 2021. And we decided to overlap some important federal policies that passed during the same time period to see if there's some kind of relationship there. In December, we know that the second round of stimulus checks were issued, and the federal supplement to state unemployment benefits was also renewed. Then in January, SNAP benefits increased by about 15%. And then in March, a third round of stimulus checks were issued. So the fact that these federal policies took place at the same time that we saw our first sustained decrease in food scarcity shows, or suggests at least, that these federal policies are helping New Yorkers be able to afford the food that they need. When we break things apart by race and ethnicity, we see really troubling disparities. The rate among Hispanic New Yorkers was over 1 in 4 Hispanic New Yorkers reporting food scarcity, and 1 in 5 Black New Yorkers reporting food scarcity in March 2021. These rates were 4 to 6 times higher than among white New Yorkers. We also saw that Asian New Yorkers had a higher rate of food scarcity than white New Yorkers. We also looked by age and saw that New Yorkers from age 18 to 64 generally had higher rates of food scarcity than those over the age of 65. And this indicates the relationship between food scarcity and employment. New Yorkers over the age of 65 are less likely to be in the labor force and probably were less likely to have experienced a loss of household income over the course of the pandemic, straining their ability to afford food. We also saw when looking at income that the lower a household's annual income, the higher their likelihood of experiencing food scarcity. In March, households that made less than $25,000 per year had a food scarcity rate of nearly 30%. Finally, we want to do a geographic analysis to see whether New York was on track with states neighboring or how it compared to the national average. This black line on the top is New York, and the red line is the US. And we see that US and New York started with about the same rate of food scarcity in May. But shortly thereafter, New York's rate surpassed the national average and has stayed consistently above the national average. Also, for nearly every month, New York had a higher rate of food scarcity than all neighboring states. It is interesting that all neighboring states, New York and the US all experienced a decrease in food scarcity starting in December, really driving home the impact of these federal policies. The next metric we looked at was child food scarcity. And this is the percentage of adults living with children in the household where the children themselves were often or sometimes not eating enough in the last 7 days because the household couldn't afford enough food. What's really worrisome is that we see that about 1 in 5 households with children report that the children themselves weren't eating enough. And this is really an indicator of the severity of the food scarcity crisis. Typically, we see that adults, when they experience food scarcity, reprioritize the food in the household to make sure that the children are still eating sufficient amounts of food. So the fact that we're seeing that the children themselves are experiencing food scarcity really goes to show the severity of the food scarcity in the household. Next, we wanted to look at the relationship between food scarcity and household employment income loss. It makes sense to us that if a household experienced a loss in employment income, that they would be more likely to experience food scarcity. So this green line here looks at food scarcity among households that didn't lose any employment income over the course of the pandemic. And the rate was about 7% for food scarcity. However, when we ask the same question about households that did lose household employment income, the food scarcity rate was 18%, over 2.5 times higher. It's particularly interesting to look at the influence of losing household employment income on food scarcity by different subgroups. So here on the right, we're looking by race and ethnicity. And we can see that among white and Asian New Yorkers, those that lost household employment income were much more likely to become food scarce than their counterparts who hadn't lost household employment income. However, when we look at Hispanic and Black New Yorkers, we see, looking at these green bars, that even New Yorkers within these groups who did not lose household employment income, they still reported very high rates of food scarcity, which is very troubling. Now, we're all aware that there has been a Herculean effort across the state to try to bring food to the New Yorkers who need it. And free meals and grocery programs have been really instrumental as part of this effort. We're fortunate that the Pulse survey does ask about people's experiencing accessing some of these programs. We see over the course of the survey that about 9% of New Yorkers reported that they or someone else in their household had access to free meal or a grocery in the prior week. And when looking by subgroups, we see that New Yorkers of color, younger New Yorkers, and New Yorkers with a lower household income were more likely to have reported accessing free meals or groceries. We're actually able to drill down even deeper and see, of those who access free meals or groceries, where they went to get those products. And we saw that far and above, the most common site for accessing free meals or groceries over the course of the pandemic has been schools. That rate started off very high towards the beginning of the pandemic, and decreased over the course of the summer, which possibly might be due to New York City's grab-and-go meal locations having fewer sites available over the summer. As New York City schools resumed in-person learning, it's interesting to see that schools increased as a location of free meal locations, possibly due to students being back in the classroom and being able to access those free meals in school. The share of New Yorkers who accessed free meals and groceries who used a school location decreased slightly over the course of 2021, reaching about 30% in March. At the same time, we saw an increase in New Yorkers reporting that they relied on friends, families, and neighbors, and pantries as a location for free food. I do also want to point out that the proportion of New Yorkers who reported that they used a shelter to access free meals and groceries is probably lower than what's actually happening on the ground. The Census Household Pulse Survey is administered by texting and emailing people to invite them to take the survey, and then people actually take the survey itself online. So it's likely that populations that use shelters might have been less likely to have been part of the survey sample. So the last cut of data that I want to share with us today is the income sources that households have used over the course of the pandemic to meet their spending needs. Now, Household spending needs includes more than just buying food, but it serves as a good proxy for us to see where food scarce and food secure New Yorkers are getting income to meet their most basic needs, which includes access to food. So the black bars here represent food scarce New Yorkers. And we see that over half of food scarce New Yorkers reported that they borrowed money from friends or family in the past week in order to meet their household spending needs. Nearly half said that they used a stimulus payment, and a third said that they used credit cards or loans. It's really troubling that these three most commonly reported ways of meeting household spending needs are non-sustainable forms of income. Stimulus payments will dry up once they're spent, and credit cards and loans can set people up for more financial hardship in the future. When we compare this to food-sufficient New Yorkers, we see that the most commonly reported source of income for those who are food sufficient are regular income sources, like those they received before the pandemic. So this really goes to show how food sufficient New Yorkers have been much less likely to have experienced job loss over the course of the pandemic. Now, before I turn things over to Sherry to provide some really important policy context, I just want to drive home just a few of the key points that we've covered today, because there is a lot of data. When looking at food scarcity overall, we saw a steady increase over the course of 2020, followed by a slight decrease at the start of 2021. And this might have been influenced by these federal policies that are helping New Yorkers better be able to afford food. Still, because the Census Pulse Survey is measuring a really severe form of food hardship, even a rate of 12% is extremely concerning. Also, when we look at child food scarcity, it's very worrisome that we see that 1 in 5 households with children are reporting that the children themselves are not eating enough. And finally, we see extremely troubling disparities by race and ethnicity, where the gaps between Hispanic and Black New Yorkers are 4 to 6 times higher than among white New Yorkers. I'm happy to take questions about the survey, its methodology, or some of our findings towards the end of our presentation, and also happy to be contacted via our website, which has my contact information. And with that, I'll pass things off to you, Sherry.
Thank you so much, Sophie, and thank you for that really enlightening update on what the Census Pulse Survey is showing. I hope that my presentation does provide some context to understanding some of the fluctuations in the data. And I think that Sophie provided some context around federal action that had happened during some points in time, and this will provide a little bit more of that context. This portion of the presentation is intended to go through each of the federal responses to the COVID pandemic and how they addressed funding and programmatic changes for anti-hunger programs, primarily focusing on the set of federal nutrition assistance programs that are outside of the emergency feeding system, although we will mention that as we go, since it's been such a critical part of the coronavirus response. Congress first acted on March 18th, 2020, with the Families First Coronavirus Response Act. And that began the process of setting up waivers and flexibilities for many of the programs that New Yorkers rely on to feed themselves and their families. It was through this piece of legislation that we began to see many of the SNAP and child nutrition waivers put into place, as well as some funding for important programs. Under SNAP, the able-bodied adult without dependent time limit was suspended temporarily, and SNAP emergency allotments were put into place. You may know these as the household maximum benefit that everybody on SNAP has been receiving throughout the duration of the pandemic. This legislation also allowed for many state waivers under the SNAP program. Under child nutrition, this legislation created the pandemic EBT program, as well as waivers for many child nutrition programs, including allowing free meals for all at schools and grab and go models in the school systems, as well as some other flexibilities around CACFP and the upcoming summer meals program. This legislation provided some emergency WIC funding and also moved the WIC model into a remote model, which allowed participants to receive their benefits remotely and also access their healthcare services virtually. Senior nutrition programs and the Emergency Food Assistance Program, also known as TFAP, each received important funding to continue their work to reach vulnerable populations. Just a couple of weeks later, Congress passed the CARES Act, which appropriated additional funding for the SNAP and child nutrition programs to account for the increased caseload that states had been seeing over the last couple of weeks. And that funding was very important to allow those benefits to keep flowing without any disruption. Senior nutrition and TFAP also were allocated additional funds to continue their operations and their services. It was also through this legislation that the first round of stimulus checks were issued and the Pandemic Unemployment Compensation Program was established, which provided an additional $600 a week for people receiving state unemployment benefits. As sort of an important caveat to that, the $600 a week federal benefit that came through this legislation was counted as income for SNAP purposes. And so for many households that lost their employer-based income and were relying on unemployment, that $600 put many households over the SNAP income limit. And therefore, those households were not eligible for SNAP in most cases. And in fact, households that were making less through their work and making a little more through unemployment, would have lost SNAP benefits that they may have had prior. So even though we saw an overall growth in the SNAP program during this time, there was an awful lot of churn underneath those numbers that, was sort of invisible at that time. So fast forward to July 2020, where Congress passed the HEALS Act. There was no new funding for any nutrition programs in this legislation, although some federal unemployment benefits were extended, which of course will be helpful to households looking to meet their food needs. And then you may recall a lot of discussion around the HEROES Act, which began in May, and the negotiations continued through October. But it's important to note the HEROES Act actually never passed, so no legislation, existed from this proposal, although portions of it were folded into other relief efforts. But as you can see, since March 27th of 2020 through the end of the summer, there had been no additional legislation passed that included specific provisions for nutrition assistance. As we moved into the fall of 2020, on October 21st, Congress passed the Continuing Appropriations Act, which allowed for extensions of many of the SNAP program waivers that had been in place in states, including New York. And there were also some extension of child nutrition waivers to extend free meals for all in the schools through the end of the school year, and also extended PEBT into the current school year that we're in right now, and to younger children as well, those under the age of 6. This legislation also put some funding into some summer EBT pilot projects across the country as well. There was also some additional appropriation for the continuation of benefits through both the SNAP and the WIC program in this legislation as well. Towards the end of the year, Congress passed the Consolidated Appropriations Act right at the end of the year. And this is where we actually saw many of the provisions that had been advocated for in the HEROES Act put into legislation and passed by Congress. The first was the 15% boost in SNAP benefits. And at that time, it was passed as a 6-month increase to run from January to June, which would give all households receiving SNAP benefits an overall 15% increase in the value of their benefits. We also saw a provision in this bill that allowed certain college students to become newly eligible for SNAP under student rules, which was an important improvement for students who were continuing to attend college, but due to student rules were ineligible for SNAP. And then there was also some funding invested to support the expansion of SNAP online purchasing, which USDA, Congress and USDA rightly recognized needed to be accelerated due to the pandemic. The child nutrition programs also saw some extensions and expansions, including some clarification around the expansion of PEBT to younger children in childcare settings. And then some emergency reimbursement funding for schools and childcare programs. This funding has proven critical for school districts that lost much of their revenue during the end of the 1920 school year, and these funds were able to help them recoup some of the funds that were lost to the drop in participation in school meal programs. There was additional funding for WIC, along with a task force to explore how to use technology to continue to serve WIC participants virtually going forward, and continued investments in both senior nutrition and emergency feeding programs as well. Shortly after President Biden took office, there was an executive order signed on January 22nd that also made some important improvements to nutrition programs. The first was to task USDA with reviewing the SNAP benefit formula, which is used to provide the benefits for households. And it asked the agency to review their authority to also provide certain households with an increased maximum benefit under the emergency allotment provision. Up until this point, households that had already been receiving their household maximum before the pandemic were not receiving additional funds during the pandemic. And so this allowed for those specific households to receive an additional $95 a month under this executive order. There was also an overall 15% increase made to the PEBT program. So as the next round of benefits started flowing, the daily average reimbursement rate for those eligible children would be increased by 15%. And then finally, the American Rescue Plan was passed in March of 2021. And here we continue to see some improvements to nutrition programs, including the extension of that SNAP 15% boost through the end of September, and some additional investments put into growing the SNAP online purchasing program. In child nutrition programs, PEBT was extended into the summer of 2021 and allows for the provision of that program for future public health emergencies. And this is also where Congress put additional funding into the WIC program and increase the monthly benefit to all participants to purchase fresh fruits and vegetables, which is going into effect in June here in New York. And senior nutrition programs rightfully continue to receive the type of investments that they need to serve their clients. Many of you have heard about the most recent proposed legislation, which is the American Families Plan. This is also known as the Human Infrastructure Plan, or the second phase of President Biden's infrastructure plan. This is proposed at the moment, and many of these provisions are currently being negotiated. But this is a summary of what that proposed plan would do for federal nutrition programs. Most importantly, it would allow for a more generous benefit through the summer EBT program for eligible children. It also makes some important improvements to community eligibility provision, which allows high poverty schools who serve a large number of low-income students to make it easier to provide free meals to all students in their district. And so through some technical changes, more schools would be eligible to participate in community eligibility and provide free meals to all students. This legislation would also increase the number of children who are directly certified for free school meals, who participate in Medicaid or SSI, and would also dramatically improve school nutrition standards and reimbursements related to meeting those standards with an additional $1 billion investment. So like I said, these provisions are still in negotiation along with others, but this is currently what Congress and the White House are negotiating as they look towards the next COVID relief package. So I'd like to pivot from the federal response to the COVID pandemic over to some of the key state actions that have happened here in New York that not only maximize those federal legislative actions, but also make the best use of the resources available in New York, and talks a little bit about how our state government has responded to some of these opportunities. So first and foremost, I think throughout the day today, you've heard about Nourish New York several times. And Nourish New York, even though it is funded primarily with federal dollars, required establishment at the state level. And so establishing this program really was a critical action to help the state's food bank networks and our state's agricultural producers provide enough food for hungry New Yorkers and to meet the need to some degree while allowing our farmers to remain solvent. So that program was funded at $35 million initially, with an additional $50 million in the most recent state budget. And that program, I think all have agreed, is a real win-win for our food banks, our farmers, and of course for New Yorkers in need. And it has allowed food banks to meet the demand to some degree that individuals have. But I think the data that Sophie has presented has shown us that we still have a long way to go to continue to reduce food insecurity. In addition to establishing that program, our state agencies have done a lot of work to implement some of the federal programs created through legislation. PEBT is a great example of a program that was brand new and stood up rather quickly in New York State, with the first round of benefits from the 1920 school year going to about 2.4 million children in New York State, totaling about $1 billion in food benefits distributed to those students for the 4 months that they lost access to school meals last spring. And round two of the pandemic EBT benefits are scheduled to begin probably sometime in June and will last through the summer. And those are to reimburse households for lost access to meals for the 2021 school year. They estimate about 2.2 million children who were learning remotely or hybrid will be eligible for approximately $2.2 billion in food benefits that will begin to go out over the next several weeks to months. Round three of PEBT, which Congress approved for the summer of 2021, will also be issued to eligible children later this year. Overall, SNAP enrollment in New York State is up about 5%. And again, I talked a little bit before about the churn that's sort of underneath those numbers. There's certainly a volume of households coming and going from the program, but overall enrollment is up slightly. But the value of the benefits across New York State has risen dramatically due to the influx of the emergency allotments and also the 15% boost provided for by Congress. At the state level, we've also seen a lot of effort put into implementing the child nutrition waivers allowed for under federal law. Most importantly, as I mentioned, free meals for all children during the current school year for those schools who are adopting that specific program. And then some key waivers have already been extended into the 21-22 school year, which will begin in September. The free meals for all option will be available again to all schools going forward in the next school year, as well as the waiving of other types of requirements that will make it easier for students to access meals. So for example, area eligibility is waived, which means that sites can operate in any community regardless of how many low-income children live there. There's also grab and go or home delivered meals allowed in where only congregate meals were allowed previously. There's also some flexibility around meal patterns and around meal timing as well, which allows a lot more flexibility for school food service authorities and others to operate their meal programs efficiently. Under WIC, the WIC program has continued to waive the physical presence requirement for the program and issue benefits remotely to those who are eligible, which has helped retain participants in the program who may have otherwise fallen off of the roster as a result of not keeping some of the required clinic appointments. So that is definitely something that I think will be a learning going forward. And then finally, New York State will implement the $35 produce benefit for the months of June through September, which will be automatically loaded onto a WIC participant's eWIC card. Getting more specific around SNAP waivers in New York that New York has taken advantage of, it's important to realize that USDA made a lot of waivers and flexibilities available to states, but states had discretion over which they chose to implement. And for much of the pandemic, New York has led the nation in the waivers and flexibilities that they have taken advantage of. So this is just an example of what some of those are to help SNAP meet the needs of those who are trying to maintain social distance or be in isolation or quarantine or otherwise avoid crowded areas using their SNAP benefits. So first of all, those who are subject to the able-bodied adult without dependent 3-month time limit, that has been waived statewide now for the full year. And there are other waivers that the local districts in each county are taking advantage of around flexibility in in-person application and recertification interviews. Many of those can be done virtually. There's also expedited processing and extensions on how often a SNAP case needs to recertify so that households can continue keeping their benefits without disruption. I put a link on this slide to direct you to a page on our website where we have been keeping track of all of the waivers and flexibilities related to federal nutrition programs in New York State. So it may be a helpful summary to just consolidate across programs what the current set of rules are that those programs are operating under. So I'd just like to take the last few moments to talk about looking ahead and what some of the advocacy opportunities may be for our anti-hunger response at the federal level. And these are some of the issues that anti-hunger advocates and many others are organizing around over the next several months. I think the 15% SNAP boost has proven already to be a lifeline for SNAP households and allows many households to use SNAP benefits to meet their food needs across an entire month rather than just the 2 or 3 weeks that SNAP benefits were previously, lasting for. We'd also like to see as much expanded eligibility as possible. For example, we saw expansion of eligibility for college students. And there are other ways in which vulnerable populations may be able to access the program more easily. We'd also like to see an extension of the cost reimbursement that I mentioned earlier for school districts and childcare that helped make up the difference of lost revenue for the 1920 school year. And we'd like to urge Congress to put those emergency cost reimbursements in place for the current school year to help schools recoup some of the lost costs to their food and nutrition programs. And then upcoming Congress is set to reconsider child nutrition reauthorization this year, which is a once in a 5-year cycle to improve the operation and the implementation of all child nutrition programs across the country. And in that process, we are urging Congress to provide free school meals for all permanently going forward. I think this pandemic has proven that universal meals is a critical piece of recovery and also sustainability for our nation's children. And we heard a lot about that in the keynote and the responders this morning. And we hope that Congress will heed the call of New Yorkers and many other states in providing free meals for all. We'd like to see expanded access to out-of-school time meals, including after-school and childcare meals, as well as expanded access to summer meals as well. Summer EBT is another way to help meet the needs of children over the summer who lose access to school meals by making the summer EBT program nationwide and permanent. And finally, we would like to see the WIC program extended by 1 year to serve children up to the age of 6 instead of the age of 5 to help fill the gap for those children that have not yet reached kindergarten and access to school meals. There are also a few state opportunities that I'd like to point out as we, build our capacity to work on state advocacy issues. And one of those, I think, that we've learned through this process is the benefit of coordination and integration of nutrition programs across state agencies. And so, we look towards ways in which state agencies can implement their outreach more cohesively, do eligibility determination and enrollment for means-tested programs in a one-stop shop rather than by program. And we know that the state is working towards this over the next few years, and anything that can be done to accelerate that would be welcome for people who need access to these programs. And then we'd also like to encourage the state in any way possible to streamline participation in the child nutrition programs that are operated by both schools and community-based organizations to provide a seamless year-round access to meals for children. And even though the state has funded Nourish New York over the next 2 years, it is not necessarily a permanent program. And so we and others join in asking for the permanency of that program as well. And just to close with a couple of local opportunities that organizations, school districts, and other advocates can look towards to make a difference in their local community, in addition to these state and federal opportunities, is to encourage schools and community-based organizations to maximize the offering of child nutrition programs by making sure that schools are utilizing the universal free school meal option when possible and where eligible, serving breakfast after the bell once COVID provisions allow for such meal delivery, and to fully participate in the suite of child nutrition programs that offer out of school time meals in summer and after school and in childcare. I'll leave you with some links to each of these program areas that we house on our website, which includes technical information as well as information about how families and systems can enroll and participate in these programs. And hopefully this will be a helpful set of resources for you. And I will just close by saying that it is universally understood that Congress's quick action and our state government's quick action to this pandemic has probably staved off a much worse hunger crisis than would have otherwise been. But we are still seeing hunger rates surging above pre-pandemic levels. And so therefore, more must be done to help ensure that New Yorkers have access to the food they need. And I think some of the data that Sophie presented, as well as the policy solutions that we're focused on, point to some viable options and some ideas for how we can continue to meet the food needs for those who struggle in our state. And so with that, I will turn this back over to our facilitator and we can take some questions.
Thank you, Sophie and Sherry. Both of those presentations were amazingly comprehensive, and I know they'll be made available if they're not already available underneath our chat box. But yes, I would like to invite anyone to submit questions, comments. We have a few more minutes left before the closing remarks start. One question was about, excuse me, thinking about, while there's definitely no silver bullet to solving the food insecurity crisis, Sherry, in your opinion, what do you think which of the programs that you spoke about do you think would have the most impact, I guess the most bang for the buck, that is another way to say it?
Well, we, as an organization, we focus primarily on SNAP and also on WIC and child nutrition programs. And I think that having streamlined access to all of these programs for families who are income eligible would be a real efficiency gained and also a real important boost to those households. When I looked at the data that Sophie presented, and I agree that the ways in which households are paying for food right now is largely unsustainable, I also find it concerning that so few households are utilizing SNAP to help, meet their food needs. And that could be a combination of reasons. It could be households who are financially ineligible, but still struggling to meet their monthly food costs, but it also could be many households who are eligible and just not enrolled in the program. And so, right now is a good time to sort of make a plug for SNAP outreach funds and to make a plug for the need for streamlined eligibility determinations and enrollment into means-tested programs across agencies and across all types of households in New York.
Okay, thank you. And I feel like we've heard that throughout the day. So, hopefully there's power in numbers. I don't see any more questions coming in. And I know we have to get off in a couple of minutes to hear Natasha's closing comments. So if there's no other comments from you guys for this panel, I think we can adjourn and get ready for the final closing remarks. And I want to thank you all for attending the session, and thank you again, Sherry and Sophie, for putting together all this amazing information for us.
Great, thank you.
Thank you all. Bye.
Thank you.
Bye-bye.